I talk to a lot of doctors, a lot of chiropractors, and I hear a common theme that I don't get paid enough money, I don't make enough money. I talk to them about cash services, and I hear a lot that, oh, my patients would never pay cash. My patients would never pay much money out of pocket because they just don't like to do that. Or I don't feel comfortable asking people for money. So I want to talk about those topics because there's a lot of data out there that is false data about collecting money and getting people to pay for services. I agree that it's a bad idea for a doctor to ever ask a patient for money. That's why they have to have somebody else trained to ask for money. Because when a patient has a doctor talking to them about money, what goes through their head is, does this guy have a Porsche? Does he have a boat? What kind of house does he live in? Why is he asking me for money? It's not normal for a doctor to ask for money. My background is I was trained in marketing. I got hired right out of undergrad school. I have a degree in marketing from Stockton University, New Jersey. And out of undergrad school, I was hired by a company owned by Dun & Bradstreet, and they trained me in sales. And sales is a science. And we all hear of the guy who's got the knack for being, you hear the saying, oh, he could sell ice to an Eskimo. That's not who we rely on. Sales should not be trying to extract money from patients unwillingly or trick them into paying. What sales is in exchange for help. So if you help somebody, you have to show them what the value is that you're doing for them. And if you do, then price will not be an issue. I'm quoting one of my colleagues, Brandon Dawson. He's a brilliant business guy, and he said, price is only an issue in the absence of value. We show you how to build value. And it doesn't start when you're asking for the money. It starts when you're examining the patient. I just want you to know we have systems for this that we train our clients on. And when we do, their cash closes go up tremendously. Let me share some of these ideas with you. When somebody is asking for money, one of the things you have to do is you have to figure out why are they actually there. Let's talk about that. When a person goes to a doctor and they have a complaint, let's say they have a knee problem. They walk in, what are you here for? I have knee pain. It's easy to assume that they're here to just get rid of the pain. But if you look into that, here's what happens behind the scenes. If people over 50, it's estimated that 50% of them have knee pain, right? So if you find people in from a marketing company on a list that are over 50 and you send out marketing to them about handling a knee problem, you would expect 50% of those people to reach back and say, yeah, I have that problem, so help me with it. But you don't get that much. You're lucky to get even a percentage of 1% as a return. So why, if you send out like 250 or 2,500 of those ads, why wouldn't you get 2,500? You only get like 10. So here's why. What happens is when people have knee pain, they put up with it and they'll close doors in their life. For example, if the guy can't garden and he doesn't really like gardening, he's going to stop gardening. And he's going to say to his wife, well, I can't garden anymore, it's too much on my knees. If he stops golfing, even sometimes guys go, I'm not that good at golf, so I don't need to golf, it's not good on my knees. But I'm going to tell you a story, it's appropriate to what we're talking about. You got a guy, he's retired, and finds out his daughter's going to have a baby, and he's over the moon thrilled. Now, he's had knee problems for years, and so his daughter comes to him and says, Dad, when I'm done having a baby, I got to go back to work eventually, and we're going to have to put the baby with somebody, and we don't want to put him with a stranger. Could you watch him? He finds out it's a boy, and he's thrilled because he's like, yeah, I'm going to teach him how to fish, I'm going to teach him how to play baseball, I'm going to teach him how to do all this stuff. So she gets all the stuff, she brings it to his house, and he starts to watch the boy. One day, the boy's starting to crawl and he's getting faster, and the mom comes home and the boy's got a knot on his head and says, what happened? He was crawling, and you know the step you have down into your living room, he got over that step before I catch him. You know my knees are bad and I couldn't catch him. He bumped his head, but he's fine. When she goes home, she's going to say to her husband, Dad can't keep up with Johnny, we got to get him babysat somewhere else. So they come back and they tell Dad that, Dad, we know with your knee problems, he's only going to get faster, not slower. We need to get somebody to keep up with him. The father's now devastated because he wanted to watch his grandson. He wanted to help raise his grandson, and now he can't because of his knees. So when he goes to the doctor, he says, I have knee pain. He doesn't say all that other stuff, but that is the motivation behind being there. The systems would be important to pull that out of the patient would be, why are you really here? That's what we teach. We teach how to get that information from the patient. When you do, they won't give you that information until they start to trust you. The reason people don't like to do sales is because most people buying things are fearful of the salesperson. Why? Because we've all been ripped off. When somebody's asking them for money, They're going to evaluate, should I trust this person or not? The missing ingredient is trust. So your system of educating your patient and extracting why they're there should also be a way that builds trust with the patient in your clinic. There's a lot of little things we do to do that, but when we do this and we build the trust and we find the real reason that person's there, their motivation to get it fixed goes up. Now, I'd be willing to guess that most of you would agree with me on this following statement. I noticed when I treated patients over the years, I didn't get somebody to come in, or very rarely did I get somebody to come in and said, yeah, I have a back problem and I just did it like 2 days ago. I never had a back problem before, and I lifted a 300-pound tractor tire, it was full of water, and I hurt my back, and now it's really sore. I did have patients like that, but they were the exception, not the rule. What I usually got was, I bent over to tie my shoe and now I can't stand up straight. Or I sneezed and now I got pain shooting down my leg. And then we'd ask questions like, have you ever had this before? And we'd find out they've had this problem on and off for 15 or 20 years. So finding out where the original injury happened is important, because you know as well as I do, when these patients come in and they say, yeah, I have back pain, it just started, and we look at an x-ray, there'll be a couple vertebrae there that are more degenerated than others. That degeneration doesn't happen in a matter of days or even weeks or even months. It takes years sometimes for that degeneration to set in, which means they had the problem for years and they coped with it different ways. When a patient realizes this, their viewpoint changes. Picture yourself as a patient. I have back pain that started last week. I go to the doctor, can you give me something to get me to feel like I did 2 weeks ago? That's the goal of the patient. But if the doctor does a thorough job, or his staff does a thorough job on extracting what was the history and what happened, we're not making a mountain out of a molehill, we're just getting it as it is. If the patient realizes, oh crap, I was in a train accident when I was 20 and now I'm 50. That was 30 years ago. And my back did hurt after that. And I've had problems with my back on and off. And you know, come to think of it, I never had a problem with my back before that injury. Oh my gosh, my problem is 30 years old. Now that's a different viewpoint, because that is what we're dealing with. We're not in the business of covering up their pain. We're in the business of improving function. And if we got a problem that's been there for 30 years, the patient needs to understand that's not going to go away overnight. And it might take some effort, some time, and some money to get that fixed. When the patient looks at it that way and they start looking at surgery and they look at us, they go, surgery is very invasive, surgery is very expensive. A lot of times the out-of-pocket part is more expensive than our entire care plan. When a patient looks at that, they go, this is a better way to go. It's going to work on the function. It doesn't create more scar tissue. We know that injury probably created scar tissue when they first had it, and it's the scar tissue that's accelerating the degeneration. Lack of movement of a vertebral unit causes deconditioning and dehydration and degeneration of a disc. If we're going to get that disc to be fixed, we got to get that movement back. And to do that, we have to break through scar tissue. If somebody goes in there and cuts through there and cuts the disc to take the pressure of the part that's bulging out off the nerve and stitches it all back up, it doesn't take a rocket scientist to realize there's going to be a lot more scar tissue after that surgery, which is why 75% of the surgeries are repeated in less than 2 years. That's a huge failure rate. If we were going to get in there and fix it, we'd have to actually get in there and do some work, and we should get paid for it. And we're not going to get paid as much as the drug companies or the surgeon, but we are going to get paid for it. We should get paid for it. If insurance only covers a little bit, we should be able to ask the patient, hey, you know what? This decompression, the insurance companies consider this experimental because it's only been around for 50 years, so it's cash. How would you like to pay for that? We have to have ways to handle that. So we train case managers on how to handle that. We have case managers handling the finances, not doctors. Where do we get that system? Straight from the hospital. I'll bet you never went to a hospital and said to a doctor, how much is this surgery going to be? If you did, the doctor would probably go like this. I don't know, but are you serious about this or are you wasting my time? Talk to the case manager at the hospital. They'll tell you what the cost is. I have no idea what the cost is. I just do the surgery. That's what you'd expect from a doctor. Whenever I got asked in my clinics, how much is all it's going to be? I would say, I don't know, you need to talk to the case manager. This is Mary. Her job is case management. She looks and sees what your insurance covers and what your out-of-pocket would be, and she helps you to be able to afford that. That's the systems that we teach. We teach case managers how to build the value by collecting the right data, which is important for correcting the function long term. It's also important for setting goals. I'll give you an example. The example I gave in the beginning about the guy chasing his grandson, if you could quantify that about how it affects his knees. Okay, when you're chasing your grandson, how good can you do that? I can't do it. It hurts too bad. If 10 was perfect and 0 was you can't do it at all, what would it be? I guess I'm about a 2. Now you have a quantified non-function level. And if we start doing re-exams on him, and all of a sudden we start to see him say, now I'm a 3, now I'm a 4, now I'm a 6, now I'm an 8, we're quantifying improvement. If we can show a problem list at the same time, oh, look at all the things wrong with his body. He's got tight hamstrings. He's got improper tracking of his patella. He's got a weak gluteus medius, vastus medialis. So his kneecap is tracking improperly. If we grade all that and say, look, that's getting stronger. Oh, look, these are getting stretched out. Oh, look, his pelvis is now moving better. And at the same time, he's saying, I can now function more. I can use my knees to chase my grandson at a higher level. You proved what you're doing is medically necessary on a functional level to get that person better. So you still have to get paid, which means you get paid by the insurance, and then you have to get paid by what's not covered. And the out-of-pocket expense that's not covered, and the services that are not covered. When we help doctors be able to do that, it's funny. They don't get the reputation of being expensive. They get the reputation of, they help me avoid a surgery. They help me avoid an opioid prescription. This is the place to go if you want to get fixed. One time I had a patient tell me that. I was in my clinic in Pennsylvania, and at this point I hadn't been treating. I was actually just being an executive. And I was working in the back, and they called me up and said, hey, we're getting ready to leave. Listen, there's a patient on therapy. Could you bring him up with you when you come up? So I brought him up, and as I got the patient off the table, they said, are you Dr. Carberry? And I said, yeah. And they go, oh, you're the owner, right? And I said, yep, that's me. And they said, would you like to know what your reputation is? And I was like, okay, what is it? They said, you're expensive. And I was getting ready to turn around and start defending myself. And then they said this, but if you want to get fixed, this is the place to go. And I realized that's the same reputation as like a luxury car or a sports car, like a Maserati. It is an expensive car, but if you want a really good car, this is the car to get. And that's a great reputation to have, and that's a reputation you should have. So we can help you put a case manager into your practice and train them properly so they can actually handle the finances with your patients, and you don't have to get caught in the middle of that. You can focus more on getting patients well, and your case manager can focus on getting paid. And that's the way it should be. So I hope you have that fortune of being able to do that. And if you want to know how we do it, so if you'd like to learn about our case management program and how to put a case manager in place and get them trained on how to handle the objections for care and the finances and being able to get paid for what you do, click the link that's either below or alongside me or above me, and it'll take you to our sales department, and they'll show you how we increase your sales by teaching you how to have a case management system.